Good day. My name is Clarenze Anlites, and today I'm gonna perform the assessment of the peripheral vascular system. So let's begin. So sir, good day sir. My name is Clarenze and I'm gonna be your nurse for today. And you
Okay.
are
Rafael.
Sir Rafael. So sir, this assessment sir is all about the peripheral vascular system. Okay lang ba sir assess ani? Na kay mga questions.
Okay lang.
So sir, the answers of this interview is private, sir. So, di na ka mabalaka, sir. So, sir, let's begin. So, na ba kayo ma-notice any color or temperature or texture change ng skin?
Kuan, aside sa barag, si bulat sa adlaw ng barag change, wala rin.
So, mostly skin lang o temperature. So, experience ba kag pain or cramping in your legs?
Wala rin.
Wala, good.
Wala.
Good. Tapos, experience ba ka heaviness or aching sensation sa mong legs?
Wala rin po.
Wala, no? Kanang mga tungod sa pagtindog, sir, kasakit yung wala ka dyan. Do you have any leg veins or that are rope-like bulging or contoured?
Wala rin.
So, do you have any sores or open wounds on your legs?
Wala rin po.
Wala. So, nabay mga swelling or edema sa mga legs or artery?
Wala rin po.
So, do you have any swollen glands or lymph nodes?
Wala rin po.
So, sir, about sa personal health history, ma-describe ba nimo ang any problems nga encounter nimo sa circulation in your arms and legs? Like, blood clots, mga ulcer, coldness, hair loss, numbness, swelling, or poor healing.
Kanaro ang swelling pero bugikan mo to siya sa tungod sa workout ba? Sa lagi na workout.
So, have you had any heart or blood vessel surgeries or treatments? Do you or does your family have a history of DVT or diabetes, hypertension, coronary heart disease, or intermittent radiation or elevated cholesterol?
Kanaro ko ng diabetes o hypertension.
So sir, do you or did you in the past smoke or use any form of tobacco?
Yes.
How much and for how long?
Kuan. Barag, dagan to siya 1 year and di naman siya barag serious to be advice. Barag per session lang ba kayo ito sa wala sa facility. Kuan. Sa isa ka session, dulo mo mga 3 to 5.
Sticks. Tapos sir, namdaman na ba nimo?
Oh. 1 year ka pinuulong.
So 1 year smoke free na ka. So sir, do you exercise regularly?
Yes.
Na unsa pud ka regular sir? Daily.
Like, barag daily. Pero na may time sa barag billar. So barag
Minimal lang ang exercise. Pero tig-exercise, yapon yun. So, mag-experience ba kag any stress in your life at this time?
Sa karon kay barag tungod sa studies kay barag iba na quarantine ta na kuan karon din barag nakagipang buhat din barag napay barag buhaton na sa balay pero di maka-stress siya nga labi na barag nagunaw na ka sa kadaghan din barag kita mga deadlines na
So sir, kanang naba kay mga problems with any circulation sa peripheral vascular system?
lang.
So, do leg ulcers or varicose veins affect you on how you feel about yourself?
Wala naman kayo nung ko
Good. So, do you regularly take medications or prescribed by your physicians to improve your circulation?
kuan pero karon wala na.
So, do you wear support hose or treat varicose veins?
Wala.
So, sir, maralito sir. Thank you. Now, palpate for the femoral, popliteal, or the dorsalis pedis, and the posterior tibial pulses. Now, for the femoral pulse, place the patient in a supine position and feel below the inguinal area, halfway between the symphysis pubis and the anterior posterior iliac spine. Now, next, for the popliteal pulse. Have the client bend his or her knees, or if on the table, roll onto the stomach and flex the 90 degrees. Then press deeply to feel. Now, for the dorsalis pedis pulse, have the client in the dorsiflex or extend foot. Now, place the finger between the patient's great toe and the first toe and slowly move away from the toes between the extensor tendons. Now, for the posterior tibial pulse, it is located on the medial malleolus of the ankle or the tendon Achilles. Now, you should inspect for any varicosities or the thrombophlebitis by asking the client to stand. Now, the deep phlebis by quickly squeezing the calf muscles against the tibia. For the Homan sign by extending the legs and the dorsiflex foot. Positive if with the calf pain. Now, perform the position change test for the arterial insufficiency while the client is in a supine position by placing the hand on both the client's ankle. Now, you should raise the legs to 30.48 centimeters or in 12 inches above the heart level. Then, you should ask the client to pop the feet up and down for 1 minute. Now, have the client to sit up and dangle legs. Then, you should note for the color of the feet. Then, any of the time interval for the color to return. Now, if the varicosities are present, perform the manual compression test by having the client stand. Perform the compress by lower portions of the varicose veins with one hand. You should place the other hand 15.2 to 20.3 centimeters or 6 to 8 inches above the hand. Now, feel the pulsation on the upper hand. Now, lastly, for the if the varicosities are present, perform the Trendelenburg test with the client in a supine position. Elevate the legs at 90 degrees for 15 seconds. With the legs elevated, apply the tourniquet to the upper thigh. Then assist the client to a standing position. Then you should observe for the venous feeling. Then remove the tourniquet for 30 seconds and watch for the sudden feeling of the varicose veins from above. So that's all, and thank you. So right now, I'm gonna explain to you the physical examination of the peripheral vascular system. So first, for the preliminaries, you should gather all your equipment such as the centimeter tape, stethoscope, the Doppler ultrasound device, the conductivity gel, the tourniquet, gauze or tissue, waterproof pen, and the BP cuff. Then, you should demonstrate courtesy and explain the procedure to the client so that the client will have an idea about what to do on the procedure. Then, don't forget to perform the hand hygiene. Then lastly, you should ask the client to put on a gown for privacy. So first, about the arms. For the inspection, inspect the bilaterally for size, presence of edema, and a venous patterning. Next is to inspect the bilaterally for the skin, color, and lesions. Next is to inspect the fingertips of the clubbing. Now, for the palpation, palpate the fingers, hands, and arms for the temperature using the dorsal surface of your fingers. Next is to palpate the capillary refill time. Then palpate the radial, ulnar, and the brachial pulses. Then palpate the epitrochlear lymph nodes behind the elbow in the groove between the biceps and the triceps muscles. Now, next step is to perform the Allen's test. First step on this is to have the client rest hand in the palm side up on the examining table and then make a fist. Then, by that, use your thumb to occlude the radial and the ulnar arteries. Next step is to continue the pressure to keep the both arteries occluded and have the client to release the fist. Then, you should note that the palm remains impaled. Then, release the pressure on the ulnar artery and watch for the collar to return to hand. Then, you should assess the radial patency by repeating the procedure as before. But, as the last step, release the pressure on the radial artery. And now, for the legs. For inspection, inspect bilaterally for the skin color from the toes to the groin. Next is to inspect bilaterally for distribution of the hair and the condition of the nails. Next is to inspect for any lesions or ulcer. Then you should note whether the margins are smooth and even for the locations such as the pressure points, size, depth, or any odors that you can smell. Next is to inspect for edema, unilateral or the bilateral. So, if the calves are asymmetric, measure the calves in circumference. Then, if the client has edema, determine if it is pitting or non-pitting. If the client is pitting edema, rate on the 1 plus to the 4 plus scale. Then, you should palpate for the legs to its temperature. Skin temperature, is it cool, hot, or warm? Use the dorsal surface of your hand. Now, for the palpation, palpate the superficial inguinal lymph nodes while keeping on the genitals draped. Now, if detected, note the size, the mobility, and the tenderness of the nodes. For the horizontal lymph nodes, palpate in the groin. Now, for the vertical lymph nodes, palpate along the inner aspect, the thigh. Now, you should palpate and auscultate the femoral pulses over the artery. Listen for any bruits.